like one of the few maybe that, stick with the field despite COVID. COVID's been crazy on the medical field. A lot of people, tapped out. They just couldn't take it. And understandably, right? Like it was just something traumatic that I could never, go through and never, visualize, people just having to choose between who lives, because you have both people who could potentially, need your help, but you just don't have the manpower to help them. Talk about how that was like and how COVID, your experiences during the height of the pandemic in 2020 and 21.
You're more of that, people dying.
Well, during COVID, I was actually in the ER. It was crazy, it was intense, it was busy. There's a lot of folks dying. And I actually got out. I actually left the ER. Because it was just too much, you're overworked, you're getting the same pay as folks that's just like chilling, doing their, day-to-day same thing, So it was a lot. There are folks that are still, hurting from dealing with the amount of death on a daily basis. There are folks who just didn't want to stay home because their colleagues were going to work short-staffed, and they just felt bad, so they just went in and they just like pushed themselves to, be a helping hand to their colleagues, but they were still dealing with trauma when they went in.
When you left,
I just pulled myself out of it. I went to the cardiac cath lab, where it was a little bit, better. It was easier.
Is there like resources for nurses to deal with the kind of trauma you deal with? Like, is it like?
There are tons, but I feel like it's not enough. There are folks from like, the employee health that would come by with like a dog to play with and things like that. But I mean, hey, like I'm not an animal person. Like,
fuck that puppy.
The dog is cute or whatever, but like, you need like hours with someone to like talk through trauma, and a lot of nurses don't have that. The hospitals give you someone that you can probably call and talk to once a month, maybe like 30 minutes. But it's not enough. They need like a whole team to like reach out to those that are struggling and like talk to them for maybe an hour once every week, maybe even more, because the help isn't there for nurses.
And specifically, why did you decide to leave? Was it because like, it was just, you said it was too much, but like, was it the workload? Was it the fact that you were just literally seeing death? Like, what exactly was it?
I saw tons of death, and it's just the workload was heavy, but I felt myself getting like tired. Like I'd be tired going into work. I'd be sleepy driving into work. My feet would be killing me because there was never enough staff. Like my left foot was like on fire every day, and I kept on going because if I didn't, I kept on going, for overtime, because if I didn't, my colleagues would have more work. And they would do the same for me, so I would feel bad, but then there became a point where it was just like, it's too much. Someone else needs to come in and do this, because I don't feel like I'm strong enough to help them.
Was it short staffed because there was too much work, or was it short staffed because some nurses decided to stop working because of COVID?
Well, in the height of COVID, only a few stopped working. We did get some help, but the volume was just so much, that you just couldn't deal.
Jasmin, what?
I had a different experience because
were you in urgent care at the time, or?
Yeah.
Okay.
So I'm in the clinic, so it's different. But I was geared up with the gown, like the cap, the blue gown, the boots, the mask, shield,
the hazmat
everything.
suit,
the spacesuit on.
Spacesuit on, exactly. And pretty much, I could see almost 200 patients a day because everybody wanted to do COVID swab, COVID like rapid PCRs, or they're sick. I have to get medication. So imagine my day just like come in, get out, come in, get out, come in, get out, and I'm the only provider there.
You're the only provider in this place?
I'm the only provider in the place, so I have to see each and every person. And I come home tired. But the most thing that really like during COVID, you see a lot of nurses, or just not nurses, healthcare providers or staff come in with depression.
Mm.
And they're like, I can't see this anymore. I can't do this. I feel like I'm gonna commit suicide. And like those times it was hard because I'm not a therapist, but I was trying my best to help these people like seek help. Like I would refer them to the hospital psychiatrist or the ER if they're really serious. It was bad.
So it sounds like you both like, and most people like they just found strength in knowing that others needed them. Like your colleagues needed you. So that's why that's soldier mentality.
Kept going.
Internalize all that stress and just keep on moving.
I was rooting, like, even though I'm not in the ER, but like I know how they feel. Like I'm rooting because that could be your family member right there, and you're just like you can't do anything.
Right.
Like, people were saying I can't see my family member because they're not letting me in the hospital. I'm like, I'm sorry, I don't know what to do. Like you gotta kind of help them like that.
And did you guys get COVID or?
Yeah.
You did?
Yeah. Actually, when I worked in the ER, I did not get COVID. I got COVID hanging out with my coworkers a few months ago. It was like COVID was like dying.
Bullshit, man.
We went to the bar and we had drinks, and like almost everyone got COVID. They're like, we work on a clean unit, so there's no COVID on our unit now. But I got COVID going to a bar.
Damn, yo, you just went through the whole pandemic, helping everybody.
Get you one way or another.
It got me.
I got COVID and my job kept calling me to go back to work the next 2 days. That's crazy.
Yeah, one of my friends the same thing because they work in a similar field, and he just got COVID, and like 2-3 days later they're like, hey,
they're like, come back. It's short.
You got that test? Let me see that test. You got that test for me? You got the negatives? And you come on back in. Damn, yo. And were you recent too, or like a while ago?
Recent.
Oh wow. Yeah.
Yeah.
Oh yeah. No, okay.
So